everyone, and welcome. Today, we're diving into a really important topic that affects millions of people, heart failure. So let's get right into it and figure out what's really going on inside the body's most powerful engine.
I mean, just think about that for a second. Your heart is an absolute workhorse, beating over 100,000 times a day, every single day. But what happens when we use that word fail? What does it actually mean when this incredible pump starts to struggle? Well, it's probably not what you think.
At its core, heart failure is pretty simple to define. It's when the heart just can't quite keep up with the job the body is asking it to do. And here's the key thing, it does not mean the heart has stopped working, not at all. It just means its pumping action has become weaker or less efficient.
To really wrap your head around this, we're going to stick with one main idea. The absolute best way to think about heart failure is to picture your heart as a pump that's having, well, a bit of a mechanical breakdown.
And this slide breaks it down perfectly. There are basically two main ways this pump can break down. On one hand, you've got the weak pump problem. The muscle itself just isn't strong enough to squeeze and push blood forward like it should. Then, on the other hand, you can have a plumbing backup. This is where the pump gets stiff and can't relax and fill up with blood properly, causing a sort of traffic jam in the system. That's what we call congestion.
Right, so these pump problems, they don't just stay in the heart. They create a ripple effect that spreads throughout the entire body. And that's what leads to the symptoms people feel and the different types of heart failure doctors talk about. Let's see what that ripple effect actually looks like.
And here's where that plumbing backup ends up. It really matters which side of the pump is having trouble. If it's the left side, the traffic jam backs up into the lungs. That's why one of the most classic symptoms is feeling out of breath. But if it's the right side that's failing, the backup spills out into the rest of the body. You see this as swelling, especially in the legs and ankles. Makes sense, right?
Now, doctors have a way to get even more specific, using something called the ejection fraction, or EF for short. Think of it like a grade for how well the heart squeezes. As you can see in the table, you've got two main categories. First is HFrEF. This is that classic weak pump problem we talked about, where the EF score is low. But then you have HFpEF. Now, this is tricky. The squeeze might look normal, so the EF is okay, but the real problem is a stiff pump that can't fill up. So you see, they're two totally different mechanical issues.
So how does all of this actually feel for a person? Well, it shows up in some really common ways. That shortness of breath we mentioned, that's the fluid backing up into the lungs. The constant fatigue, that's because your muscles and organs aren't getting enough oxygen-rich blood. And of course, the swelling is a direct result of that fluid backup. These are the big warning signs to look out for.
Okay, so we've got a good handle on what's happening. But the next big question is, why? Why is the pump breaking down in the first place? Let's play detective for a minute and look at the common culprits and how doctors figure it all out.
It turns out a lot of things can put a strain on the heart over time. The number one cause, by far, is coronary artery disease. That's when the heart's own fuel lines get clogged up. But other things, like years of high blood pressure, a previous heart attack that left a scar, or even faulty heart valves, they all force the heart to work way too hard, and eventually, it can just get worn out.
So, with all these possibilities, how does a doctor go from someone describing their symptoms to actually confirming, yes, this is heart failure? Well, they have a really great set of tools to do just that. It's really a step-by-step investigation. It always starts with a good physical exam and just listening to the person's story. Then blood tests can look for a special hormone called BNP. It's like a stress signal the heart sends out when it's struggling. Things like a chest X-ray and an ECG give even more clues about the heart's size and electrical rhythm.
But really, the absolute star of the show is the echocardiogram. It's basically an ultrasound of the heart. It gives doctors a live, moving picture of the pump in action. This is the test that truly confirms what's going on, and most importantly, it's how they measure that ejection fraction to figure out exactly what type of heart failure it is.
So once the problem with the pump has been diagnosed, it's time to open up the mechanics toolkit. And the really good news is that this toolkit is bigger and better than it has ever been before.
The whole game plan for treatment has two main goals that go hand in hand. Goal number one is to deal with the immediate problem, all that fluid overload. This is all about making people feel better right now. But at the same time, you have goal number two, which is arguably even more important: protect the pump for the long run and stop it from getting any weaker.
Now, to get rid of that extra fluid, the main tool in the kit is a type of medicine called a diuretic, which you might know as a water pill.
It's pretty straightforward. They tell the kidneys to get rid of extra salt and water. This directly lowers the fluid level in the body, which takes a huge strain off the heart and can make breathing easier almost right away.
And now for the really crucial, long-term job of protecting the pump itself. We have an amazing lineup of medications for this. Don't worry about all the names, but think of these drugs as putting a protective shield around the heart. They are proven, without a doubt, to help the heart work smarter, not harder, stop it from getting worse, and help people live much longer, healthier lives. They are the absolute foundation of modern treatment.
Okay, so we've gone through how the pump breaks down, the symptoms, the causes, and the tools to fix it. But if there's just one crucial thing to take away from all of this, what should it be?
I think it's this. The words heart failure sound absolutely terrifying, but it does not, and I repeat, does not mean your heart has failed or is about to stop. It's a serious condition, for sure, but with today's incredible treatments and some lifestyle changes, it's become a manageable journey. It's all about learning how to best take care of the pump so you can live a full and active life. Thanks so much for tuning in.